Meanwhile, Akwa Ibom State Agency for Control of AIDS, in collaboration with Clinton Health Access Initiative, has emphasized the importance of decentralizing mental health screening across tertiary educational institutions. AKSACA, during a workshop on HIV self-testing and mental health screening for adolescents and young people in tertiary institutions in Uyo, stated that the training will facilitate early detection and intervention for students facing psychological challenges, including those related to HIV and AIDS. ADBN's correspondent Emmanuel Silas tells us more.
With Akwa Ibom State having one of the highest HIV prevalence rates in Nigeria at 5.5%, the state government is intensifying efforts to improve prevention, early detection, and treatment adherence, especially among young people. One of such initiatives is a workshop on HIV self-testing and mental health screening aimed at empowering adolescents and young adults in tertiary institutions with the knowledge and tools to take control of their health. Speaking at the events, the program manager of AKSACA, Dr. Enobongokpan, emphasized that the workshop was designed to equip students with essential knowledge and resources in a safe, supportive, and stigma-free environment.
Emerging trends in risky behaviors among our youths and adolescents. We want to ensure that this time around we beam our searchlight a lot on our young people. And our young people is not just, they're not only people from the tertiary institutions, even our secondary schools. So that journey begins, and this is just the beginning. SACA will ensure that we beam this searchlight very strongly to ensure that we begin to address some of the trending issues amongst our young people.
AIDS program coordinator at the State Ministry of Health, Dr. Imosa, encouraged young people to take responsibility for their health by using HIV self-testing kits regularly, emphasizing that self-testing promotes awareness and early detection, which are key in the fight against HIV/AIDS.
Using the HIV self-testing kit, it gives you privacy of doing it just in your bedroom, so that other people that you might be afraid of, maybe you go to the lab, you go there, you recognize the lab guy, and you'll be afraid that it will spread. But the HIV self-testing kit gives you the opportunity of doing it in your bedroom. It's you that will see the results. It is you that will now come to tell us, oh, this is what is happening, this is what is happening.
The focal person for the prevention of mother-to-child transmission of HIV at the State Ministry of Health, Mrs. Xavier, and the Acting Director of Health Services at the University of Uyo, Dr. Urwagosanga, described HIV/AIDS as a global pandemic.
A peer educator should be able to have the right information about HIV, and is also saddled with the responsibility of ensuring that the next person gets the right information so that it will take the right decision.
We like it or we don't like it, it is a global effort to reduce. You could see how Akwa Ibom State is high up there. But I know that with the efforts that are being done in these big offices with these highly trained, skilled workers, we are going to bring down our indices in Akwa Ibom State.
Participants at the workshop shared their experiences and pledged to educate their peers on HIV prevention and mental health management.
To do this activity for adolescents and young people, and not just that, so that we can also escalate this information whereby young people can work with each other, so that via then there could be this easy relationship whereby young people who get to know of the benefits about the HIV self-test and also the mental health screening.
And as a peer educator, I have learned to show passion for people with HIV and also to help in the reduction of HIV stigmatization among people on campus.
Emmanuel Silas, ADBN.